So the SYNTAX trial was initiated over 10 years, indeed, and they randomized patients with 3-vessel disease and left main disease to undergo PCI with drug-eluting stents, first-generation drug-eluting stents, versus CABG. 1,800 patients were randomized, and of course the 1- and 5-year results have been presented and reported previously. However, now in the SYNTAX extended survival study, we've aimed to look at all-cause death at 10-year follow-up in all randomized patients which underwent either PCI or CABG. So the primary endpoint of the SYNTAX extended survival study was all-cause death at 10-year follow-up. In the overall cohort of 1,800 randomized patients, we saw that there was a small 3.5 difference in all-cause death in favor of CABG. However, it was without statistical significance. Mortality rates were 27% in the PCI cohort versus 23.5% in the CABG cohort. However, if we look into the pre-specified and important 3-vessel disease subgroup, we saw that CABG provided a significant survival benefit over PCI at 10-year follow-up, resulting in a 7% mortality difference between treatments. While in patients with left main disease, we saw that PCI was performing equally well as CABG, which was reassuring to see at 10-year follow-up. So at 10-year follow-up, we have achieved completeness follow-up of 94%, which is a remarkably high number in a randomized trial, such as the SYNTAX trial. We are the first and largest study to report on all-cause death at 10-year follow-up in patients with 3-vessel disease and left main disease that underwent PCI with drug-eluting stents and CABG. So, especially if you look at the mean age of a patient was 65 years old, and currently follow-up has only been reported at 1- and 5-year follow-up, the life expectancy of such a patient is far exceeding the relatively short follow-up. Therefore, it's important to look at the 10-year results from the SYNTAX extended survival study. And this could be helped or aid patient discussion and a heart team discussion where cardiac surgeons and cardiologists will discuss what treatment is the best for an individual patient.